Radio City presents Ask Maarga.
Alcohol addiction is known to be familial in the sense that there are some genes that you inherit from your parents which can increase your risk of developing addiction if you start drinking. It can also be the things in the environment. For example, if one of the parent is drinking, it can lead to many legal and social consequences, including poverty, changes in the way that they parent a child, all of which at times associated with the other adverse events can make one person develop addiction. Also, some other conditions known to cause addictions like attention deficit hyperactivity disorder or anxiety disorders or depressions, they are also known to have genetic basis in the sense to be prevalent in the families. So in that way, yes, to a great extent addiction runs in families. Alcoholism is similar to any other medical condition which can be effectively treated, not by putting a person involuntarily in a place from where he cannot escape for months. We at Maarga definitely not do that, and it is with the wish and will of the patient that we admit them. We evaluate the causes which leads the person to go into addiction and try to address them. Also see what are the symptoms which happen as a result of sudden stopping of drinking, which may include tremors, at times confusion, seizures, which are managed at a psychiatric intensive care unit, very well equipped one, following which he will be stabilized in the inpatient care where they will be given input on how to manage the craving. We also offer medicines which are known to reduce the craving called as anti-craving agents. We have options called as deterrent, taking which, if person goes back to drinking, will have serious consequences which makes person not to go to drinking at the level of punishment, and also psychologically enhancing person's motivation to stay away from the alcohol and continue to stay away from the alcohol, which again is another difficult thing, and our psychologists are very well equipped to handle this at individual format as well as the group format. We usually hear this question, is there any safe limit for drinking? Also, there is a myth saying some amount of beer a day is good for cardiovascular health. Then I would like to say there is nothing called safe level of drinking for health. There is safe level of drinking maybe for driving if you are planning to drive after a drink. They say one drink in an hour keeps your alcohol level to the level where you can drive actually, but with respect to health, no level of alcohol is good for health. We call 2 drinks in a day for a man and 1 drink of a day for a woman as moderate drinking, which also is known to have many health results. So the ideal and the best advice is to keep away from the alcohol even a bit if you are consuming it on everyday basis.
Radio City presents Ask Maarga.